Now, anytime we're talking about surgery, we always have to talk about the potential risks with surgery, as this is part of the informed consent. Overall, these risks are extremely rare and certainly typically happen less than 1% of the time. But one of the potential risks is infection, nerve injury, a bleeding problem, a blood clot, and we're at higher risk with living in altitude, so we use aspirin for 2 weeks after surgery to help protect from blood clots, an anesthesia complication, which the anesthesiologist will review with you, and then also the risk of postoperative stiffness, and that's why we do that preoperative rehab prior to ACL surgery. All right, so when we look at outcomes following ACL surgery, the biggest thing is typically if you complete your whole rehab protocol, which could be anywhere from 6 months to a year following ACL surgery, it's very rare that you'll re-tear your ACL as long as you maintain your strength. So ultimately, most patients are very happy with the stability in their knee as long as they go through the rehab protocol and they regain their motion, their strength, and their stability in their knee. Let's talk about the postoperative medications unless you have an allergy which would prevent taking one of these medicines. So first, we have you get some over-the-counter aspirin, 325 milligrams to take per day for 14 days, and that'll be helpful for preventing blood clots. We live in altitude, so we're at higher risk for blood clots. Naproxen is an anti-inflammatory that's similar to prescription at strength Aleve. And we have you take this for 14 days as it can be helpful for decreasing swelling and also can help with pain. Some patients can get some stomach irritation related to taking the medicine, and if that happens, you'll just need to stop it and let us know. Norco is the main pain medicine. It's a narcotic medicine that can be helpful for pain, and most patients will only take it for a couple days. Up to 10 days is kind of the maximum amount of time patients tend to take this medicine. Remember, narcotics have some side effects as they can affect the way you think and can also cause some issues with stomach irritation or constipation. So we want to try to limit the amount of narcotics we take. Valium is another controlled substance that helps out with muscle spasms. Typically, patients take this for a few days and at most for 10 days. Keflex or clindamycin is an antibiotic we typically prescribe for 1 day after surgery as it can be helpful to prevent infection. We also do some IV antibiotics surrounding surgery. And Zofran is a medicine that helps prevent nausea and vomiting after surgery that you can take as needed if you have any of those issues. So after surgery, we have a specific ACL protocol that's designed for you to help protect your ACL and recover from surgery. So first is the initial protection phase. For 6 weeks, we're going to be using an ACL post-op brace to help protect that ACL as it starts to heal. If you have a meniscus repair, typically that ACL brace is going to be locked out straight where you'll be walking peg leg for the first 6 weeks. If you don't have any meniscus repair, then typically we have the brace open. We also want to use crutches, 50% weight bearing for the first 2 weeks after surgery, as this is used to help bring down the swelling and help protect the ACL. Now in some cases, if you have a meniscus repair, you may need to use crutches longer than 2 weeks. We also like to start physical therapy right away after surgery. So basically the next day after surgery, we want to get started with physical therapy. And you'll continue to see the physical therapist on a weekly basis until you're 6 months out. The physical therapist will give you updates and therapy exercises and a home exercise program on a weekly basis. We also use TED hose and these SCDs or compression devices for 2 weeks after surgery as another measure to try and prevent blood clots. Also, the day after surgery, we want to see you in the office to review how you're doing, review post-op pictures with you, and change your dressing if necessary. This will be coordinated with that first day visit with physical therapy. Then again, we're going to want to see you 10 to 14 days after surgery to see how you're progressing and take your stitches out. This would be with myself or Dr. Genuario. We'll also see you 6 weeks out from surgery for another clinical recheck, and this can be with the doctor or the PA. At that point, We're anticipating significant improvement in your range of motion, and that's what we'll be assessing at your clinical recheck. We'll also reassess you 12 weeks out from surgery. And at this point, you certainly should have full motion, and you'll be starting to progress some with strengthening. Anywhere from 12 to 16 weeks out from surgery, you may start a light jogging program or a walk-run interval program, and this is designed by your physical therapist based off of how you're doing with strength. At 18 weeks out from surgery, we want to reassess you in the office again, and we're anticipating certainly full motion, fairly good strength, but you'd still be progressing with strength for sports activities. At 24 weeks out from surgery, that's typically the last postoperative check with myself or Dr. Genuario, and it may be a time where you could start sport activities, but you would have to pass a sports test with the physical therapy team. All right, so finally, let's just talk about a couple pearls when it comes to ACL surgery. First, we typically look at full return to sport can vary for patients anywhere from 6 months to 12 months after surgery, and you must pass a sports test with a physical therapy team prior to returning to your sport. The other thing is ACL sports brace is certainly an option. Ultimately, if you want one of those to help further protect your knee as you return to your sports, we typically get you fitted with it around 4 to 4.5 months out from surgery. Since this gives a chance for your quad muscle to regain all its strength, that way the brace will fit better. It's certainly an option. We think it's most important that you pass a sports test and have good strength, as that's more important than having an ACL brace. Finally, just remember when preparing for surgery, we don't want you to eat or drink anything after midnight the night before your surgery, except 5 hours prior to surgery. We recommend a 20-ounce Gatorade, as hydration has been shown to help prevent blood clots. All right, if you have any other questions about ACL injuries or ACL surgery, just reach out to myself, Dr. Genuario, or anybody on our team, as we can help answer those questions. Thanks.